Dean, the PD-1 inhibitors in bladder, kidney cancer, tell us what role they may play there, what the data has been so far?
Well, in terms of perspective, if you look at renal cell carcinoma, we've been using immunotherapy for many years. We look at IL-2, and one of the problems with IL-2 is that although we have a 4% long-term survival rate, we had a 5% toxic death rate. It was exactly the same, which is really problematic, not frequently used, selective. We moved on to interferons, and again, poor in terms of response and benefit. And in the last decade, we have all the anti-angiogenic drugs. And this was really novel and highly effective. We don't see much in the way of CRs. We see mostly partial responses. But along comes nivolumab. And in a randomized trial comparing to everolimus in patients whose disease had progressed after first-line anti-angiogenic therapy, head-to-head comparison, and some of the similar findings that you see in other diseases. First of all, it was a much higher response rate for nivolumab, and the survival was clearly superior in patients who got nivolumab versus those who got sorafenib, everolimus as second-line therapy. And the toxicity was substantially less. In fact, with a 6-month improvement in survival from 19 to 25 months, you had half the toxicity with nivolumab than you did with everolimus. So that's encouraging, and sort of the same kind of observations that benefit for all expressors with regard to PD-1, so you don't have to use a selection. And as a consequence of that finding, we know it's an active drug, and now we're starting to move forward to first-line therapy. It's happening now, and I suspect these trials will be reporting out very, very quickly.
Yeah. In bladder, too?
So in bladder, a little different story. In bladder, actually, nivolumab is actually active in bladder cancer. At these meetings, at the ASCO 2016, Pam Sharma from MD Anderson is going to present the data from Checkmate 25, excuse me, and it shows that it's active. The response rate is 25% in patients who are heavily pretreated for bladder cancer. Now, if we know, just looking at that population, the median survival of patients for second and third line therapy for bladder cancer is roughly around 7 to 8 months. 1 year survival is pretty uncommon for the patient population. In this study of 78 patients, the response rate was 25%, basically twice what we would see with chemotherapy in that setting. And the 1 year survival was 50%. So that's highly encouraging. Mm-hmm. We're waiting for the breakdown with regard to PD-1 expression, et cetera, and the right. Mutational load analysis, et cetera. But the bottom line is it's active, and it's undergoing more in the way of trials. Pembro is also active. Actually, it's been reported in a phase 1 study, and was 27% in PD-1 expressors based on the assay that was just discussed, and now is in a randomized trial against standard chemotherapy in the U.S. and standard chemotherapy in Europe, which is drugs that we don't have.